Hi, my name is Nessim, and I use they, them pronouns.
My name is Margo Faulk, and I use she, her pronouns. We're fourth-year medical students at the University of North Carolina, Chapel Hill School of Medicine, and we are Albert Schweitzer Fellows. He worked with the Student Health Action Coalition, or SHAC, to create a free gender-affirming care clinic for transgender patients in the Triangle.
Our goal was to improve the health of the trans community by providing gender-affirming care and primary care to trans people who do not have access to culturally competent, affordable care. The other part of our goal was to create opportunities for health profession students to gain experience in serving this marginalized community.
Our clinic moved through different phases throughout the year. Some of the first things we did were to help create a welcoming clinic environment for trans patients at SHAC by creating a really trans-affirming environment. So this included revising all of the paperwork so that there were spaces for names and pronouns, also training all of the staff and making sure that there were appropriate bathrooms for our patients to use. We also established relationships with different community partners before even beginning the clinic to make sure that we had good community buy-in and that there was enough need actually for this clinic in the community. We also recruited 3 amazing attendings and a bunch of student volunteers, which came on at different points throughout the year. Currently, we have many different roles for students, including patient navigators who help our patients learn how to do injections. We have student providers, we have clinic coordinators and community liaisons, and peer educators who help train up new staff members throughout the entire SHAC clinic on how to provide transgender competent or affirming care. Finally, we also partnered with the Message program, which is a UNC School of Medicine program, to create a pipeline for medical students who are providing gender-affirming care as part of their future clinical practice.
We had many exciting milestones and outcomes for our project, most of which happened in our clinic. We carried out monthly clinics starting on June 19th, 2019. We have had, up till this point, 9 in-person clinics and 1 virtual clinic. We have seen 26 patients at over 49 visits total, which doesn't even include the telehealth gender-affirming care. Of the 26 patients, all of them have received gender-affirming care, and 18 of them, which is 69%, received primary care. Gender-affirming care in this case means prescriptions for hormones, injection supplies, and other supporting documents. And primary care in this case means anything from pap smears to tobacco cessation support to hypertension treatment and management, mental health, STI testing, etc. 5 of our patients have transitioned to more permanent providers, which is excellent and ultimately our goal at the clinic. And we've connected many of our patients to services and providers both at SHAC and in the community. This includes mental health, legal aid, community health centers, tobacco cessation, and many others.
The other main goal of our clinic, as we talked about, is helping to educate other students, other future health providers on how to provide care well for transgender patients. So in order to achieve this goal, we designed a curriculum, which we called LGBTIQA Health 101 for SHAC volunteers. So far, we have had 10 training sessions and trained over 109 SHAC volunteers. And these include students from a variety of health professions, including medicine, nursing, social work, and undergraduates who are in the pre-health tracks. In terms of our outcomes for our education, 59 of the students we trained, which is about 54%, significantly improved their knowledge of transgender health, and 79 students, or 66%, significantly increased their comfort in providing care for transgender patients.
Our goals for 2020 and beyond are many. For now, we are continuing to onboard our new team and refining the roles of the 14 new team members. We are establishing a community advisory board and continuing to work on getting transportation and medication scholarships for patients to ensure that they'll be able to access gender-affirming care even if they can't afford the hormones, and to be sure that they can access our clinic even if they don't have a car and can't afford a lift. We're also working to continue our partnership with the UNC School of Pharmacy and working on attaining sustainable sources of funding to fund our clinic in perpetuity.
We wanted to say a huge thank you to everyone who made this possible. We could not have done this alone. Thanks so much to all of our volunteers, and a very big thank you to Dr. John Alcott, one of the first people to believe in this clinic.